Hello, my name is Mark Baines, and welcome to Assessments and the first client training session with Training Made Fun. This is video segment number 5 of 6, all 20 minutes or less total time. And now we're talking about the fifth particular segment. Make sure you review the first 4 segments before moving forward so that everything makes sense and is more cohesive. With that said, we're now talking about static and dynamic posture. With static posture, one of the things we want to assess is someone's recognition of their particular position in space while standing. While they're standing there, how are they positioned? Can they keep their head centered over their shoulders? Is there from the plumb line going straight down from basically their nose, their chin, their sternum, their belly, their groin, and hopefully equal split between their legs? If anything looks like it deviates left to right, something is higher than it should be looking at from the front. When we're talking about looking at from the anterior, right, looking for the front. Anything looks like it's out of alignment. The head tilted to the side, the shoulder higher than another one. Perhaps it looks like maybe one arm is rotated forward more than the other one is. Maybe it looks like one knee is turned in more, or one foot's turned out more. Whatever you see, don't worry about whether you're right or wrong. Just note what you see. We'll worry about whether it's accurate or not later. We want to have a good general idea of what's going on with this particular person's position while just standing there. Some people are so good at this they can determine a lot of information from just looking at posture. Now, there's never such thing as a one test that's an end-all, be-all, tell-all assessment. However, this is one test that can give you a lot of good information. And it is home base. The person's home base is standing upright, right? If you ever get the impression the person's standing abnormally upright, or it looks like they're not relaxed and they're standing abnormally tall, knowing you're looking at their posture, you can either distract them by asking them to for them to tell you about their day, what's going on today, what do you have going on, try to get them distracted and talk to them as you're walking around them. The whole test should take no more than 60 seconds. Or have the person march in place. They mirror you and march with you, march at a faster and faster pace if they can do this, and just tell them to keep going, then say stop. And they return to their posture position right from that moment and quickly assess rate them and get them distracted once again and start talking to them about what's going on the rest of their day. Just ask them to keep looking straight ahead. Whatever you can do to get a good general idea of what their general posture is. We're not worried about perfect posture. We're not worried about trying to find major things here. We just want to have a good understanding of someone's basic position. And it's a good starting point. And looking for the front, we want to make sure we don't want to see too much deviation left to right. I want to see the head tilted one side or another, one shoulder higher than another, the spine possibly rotated. One hand looks like it's actually one arm's almost reaching like it's reaching longer than the other one is, or one foot's tilted out to the side. Plumb line from nose, chin, sternum, belly button, groin, and right between the feet, right? And then from the side, we're looking for ear, shoulder, hip, knee, ankle. Anything that deviates basically forward or backward that you can tell or looks like it's rotated. Don't worry about whether you're right or wrong. First few times you do this, it's going to be a little bit challenging because you're not sure exactly what you're looking for except for that general idea of equal left to right symmetry from the anterior, equal front or anterior to posterior symmetry, looking like it's balanced ear, shoulder, hip, knee, ankle. If it looks like it's out of balance, write it down. Head is forward. And use words like slight or significant. Slight forward head, significant forward head. If you know that that's actually cervical protraction, then you can write that down. But otherwise, just write down what you see until you get really good at doing this on a regular basis. From the posterior aspect or behind them, same concept as the anterior. Now you're looking basically down the spine, right down the middle between their shoulder blades, middle of their hips, straight down, hopefully separated between the left and right equally. Anything that looks like it deviates, write it down. If it doesn't stand out to you immediately, pretend it doesn't exist or it's not significant. Because you don't want to try to look for problems. If it doesn't stand out, then don't worry about it. The expectation is you're going to find something that stands out, and we're going to see something that shows even more when they start to move more. Stuff you see when they're standing still will become much more evident as they move more and more as well. Dynamic posture. Look at their balance here. Now, static posture assesses kind of the general recognition of symmetry, left to right, front to back, right, or left to right from the front and the back, and then front to back, looking at them from the side. Also, do they look like they're balanced while they're standing there? And of course, dynamic posture, where they're moving, dynamic, static being still, not moving, right? We're going to use the squat test, whereby they'll have their hands over their head, they'll be reaching over the top of their head, and they'll try to squat down, controlled as low as they can possibly go. You should be looking around, walking around the person, looking at them while they squat. Just tell them to squat very naturally. Give them 3 basic cues here. Have them to bring their hands over their head. Tell them to keep their arms straight up in the air. Try to tell them to squat as slowly as possible and to squat as low as they feel comfortable going, and don't stop until I tell you to stop. Or if you feel pain or discomfort, then you stop and let me know. Okay? That's what we're really going to have them do here. And we want to see if they can control it, if they look symmetrical, left to right, Do they look fluid and smooth? And basically we're going to give them a score of a 0, actually, if they have pain, if it hurts, if they can't even get anywhere near parallel, or they can't even get a 90-degree angle from the hip, knee, ankle position there between those 3 joints. If we can't get at least 90 degrees there and they feel pain before that point, they get a 0. Now, we're talking about someone can get their hips well below parallel and they start to feel pain then. No, we're not talking about that. We're talking about someone getting pain before they even get to even what is a reasonable, almost seated position. Okay? They get a 1 if it just doesn't even look like a squat. We don't even know what that is. They're leaning to the side. They're rotating significantly. Their arms are all over the place. They're falling forward quite a bit. Anything that deviates from not be able to keep their arms in line with their spine, not be able to keep their shoulders over the middle of their shoe the whole way down, okay? Not be able to keep symmetry looking left to right where it looks the same, not looking fluid, anything turns away or moves out, the feet turn out, anything, okay? Then we're going to give them a 2, okay? And if they can only get a 3 if you have them squat quite a few times. How long? Don't know. Could be a couple minutes. Could be only a few squats. You'll decide. You're the coach. You're the trainer. Assess as long as you need to. Generally speaking, we often say the better they squat, the longer they will squat for, because we want to make sure, in fact, we're seeing what we think we're seeing, which is a very good squat. So we want to make sure of that. And when we say level 3, what we're really saying is we find no specific movement skill issues here whereby there's some sort of flexibility or strength, mobility type issue, such that we feel like we probably could give you a little bit of load if we wanted to, or do repetitive squats and not worry about them. Level 2, we're saying we're pretty darn good, but we're not really sure if you want to be loading you externally just yet, until we make sure you don't have any significant deficits. Because if you can't even do a normal body weight squat with good form, the expectation would be the moment we add load to you, the squat's going to become that much worse, thereby putting a lot more stress negatively on joints and connective tissue. We spend far too much time with training worrying too much about muscles without understanding that if the joint takes too much stress, it just doesn't matter, because the muscle is going to start feeling that stress soon enough, and we're going to have problems with being able to move the joint, let alone worrying about trying to work the muscle. Joints come first. We've said that before. We're going to keep saying that. A 1 is a bad squat such that we got to teach them how to squat. This person probably doesn't do this on a regular basis. They get a 1, and you can tell. 1 is pretty obvious. They don't look like they do anything other than maybe fall into a chair and shove off to get back up again. They don't exactly sit into a chair. They actually probably fall backward at a certain point. The majority of people don't actually squat on a daily basis. They actually sit part of the way down toward the chair, fall the rest of the way. And then we wonder why they can't squat well. Well, because they don't do it. Certain segments of the world population, people will sit down basically almost under the ground with their feet flat on the ground and put their hips well below their knees down to almost touching their heels. There is absolutely nothing wrong with squatting that low. That is perfectly okay as long as the person remains symmetrical left to right and looks smooth and fluid when they do it. The mere fact they can do that, that person's probably going to get a bare minimum of level 2, maybe a level 3 squat. The only reason you again would give them a 2 is that something stood out to you that didn't look right. Okay, there are a lot of variations on what may or may not be ideal here, but this is a good starting point to go from to see what someone's capabilities are from a general standpoint of mobility at the hip, the knee, the ankle, the shoulder, and general spinal stability. Okay, and then moving on with more specific muscular strength and muscular endurance type assessments. 1 rep max tests, which is something a lot of athletes do in high school, college, and professional sports, like a maximum bench press, barbell bench press, laying supine on the bench, standing, doing a standing barbell deadlift, or a barbell squat, right? Those tests are fine for what they use it for from the standpoint of want to see, generally speaking, how someone progresses for maximal strength. There's nothing wrong with that. Unfortunately, there are a lot of people that probably really have no business worrying about or should be spending much time worrying about how much they can lift 1 rep max when they don't move well. They have movement issues, flexibility problems, mobility problems, issues with overall muscular strength endurance, let alone trying to work on maximal strength. If they don't move well and aren't already really, really strong, we don't even want to do 1 rep max tests. So we probably don't want to do that first day out for sure with anyone, even if they tell you they're a former athlete or a current athlete. We'll worry about over time whether we want to spend any time doing something like that. That's a choice you can make as a trainer. That said, definitely not day 1. 10 rep max, whatever you can lift 10 times, is pretty consistent with about 75% of 1 rep max. In other words, if you could bench press 225 pounds 10 times, then you were looking at the ability to probably do it minimum, or almost certainly about 300 pound 1 rep max. Okay. Generally speaking, too, about 2/3 what you can do 15 reps of, if you want to go even farther than this, is about basically whatever you can do 15 reps of is about 2/3 of your 1 rep max. So if someone could do 200 pound bench press and do it for 15 reps, you're looking at about a 300 pound 1 rep max. Okay, if that's something you want to look at too, if that's a concern for you or you and your client. Otherwise, tests we want to really potentially promote here are, for core strength and stability, is the plank, which is basically just laying prone on the ground on your elbows with your forearms parallel to each other. You're looking straight at the ground, looking down. Your hips and your shoulders and your neck or your spine are all level. And there's a general natural slope downward from your hip to your ankle. Things we'll practice at the workshop itself. Things that you can look deeper into from here. But a basic plank is holding yourself still. A lot of people tend to bring their arms in together and they're taught that way. That's called cheating, because you're using your upper body to hold yourself up more rather than trying to really engage the core to keep you upright or stable, which requires you to keep those forearms parallel to each other. We do not want to have someone have their hands come together. Some people put their hands on the ground. Really would rather you not do that, because the tendency is when you pronate your forearm like that, towards pronation, the tendency is the elbow tends to want to go outward. It's very difficult to maintain that position without having the elbow turn out. So we usually say 2 fists or at least parallel arms from an anatomical neutral position, or we should say, excuse me, from a basically anatomical neutral, yes, position for the forearm, okay, so that the wrist stays level here as opposed to pronated or supinated. You can do supinated, but again, you have similar issues with rotation of that shoulder potentially on top of that. So probably recommended to do more of a neutral type position. How long can you hold it? Some people say 2 minutes or more is expected for someone who's supposed to be a reasonable athletic skill capabilities or athletic capability. There's no exact number on this, but 2 minutes is a fair number that we hopefully would see for someone with good core stability strength. Like all tests, this is not an end-all be-all, but it's very objective. You can either do a plank or you can't. So it's a good way of actually assessing someone's basic core strength. Anyone who has difficulty getting up and down from the ground, or they did the posture test and the squat test, and they clearly don't move well at all. Coordination is a major issue for them, major flexibility or joint-related problems. Then we may want to skip maybe some of these tests here, maybe skip all of them. You as the trainer always have that prerogative to make choices based upon what you see in front of you. You need to be clear about the expectation of what you want from your client, what your client expects, and what's fair. Okay? The push-up would be something we'd only do if the person could already do a plank. Now, a lot of people want to bring their hands in close together or put their hands out really, really wide, doing variations on push-ups. We want you to basically have your forearms be parallel to each other, such that at the bottom of your push-up, your forearms are parallel. So you put your hands out wide enough that your forearms are parallel. What we typically have people do is put their thumbs on the nipple lines, and we spread their fingers as wide apart as they can from their hands, from their thumb, while laying completely prone on the ground. Wherever the pinky is, put the thumbs there. That, generally speaking, gives you about a neutral, or we should say about a natural position whereby at the bottom of your push-up, you'll have parallel forearms. Why not wider than that? The wider you go than that, it's going to inhibit range of motion. Why not closer than that? It's going to actually rotate that shoulder most likely, as well as put more stress on the elbow and the wrist. We're not trying to add more stress to the joints. We're trying to minimize stress to the joints to get the benefit of the basic concept or motion. We'll talk more about that in biomechanics in greater detail. With that said, that push-up, how many push-ups can that person do? They won't want to go any more than 100 degrees of motion, meaning the elbow should barely past that shoulder, the very, very most, at the bottom of that push-up. No going chest to the ground, because that pectoralis major muscle group will become actively insufficient when it gets so elongated it can't produce force any further or farther beyond that point when you start dropping below that shoulder significantly. You can actually go about 10 degrees past your shoulder with the elbow passing behind you. Any more than that would be too much. You don't have to go that far, but that's about what we're looking at for most people. Pull-up, if you can't do an actual pull-up, which is basically just like an overhead press, parallel forearms and reach up and grab that bar. If they can't pull themselves completely vertically without leaning backward, without throwing the hips into it, nothing whereby we're not talking about kip-ups here. This is a pull-up. Pull-up is a maximal strength exercise for most human beings, meaning something they probably can't do more than a couple of, if any at all. If you can't do it well, just like the push-up or the plank, no one has bad form. We don't allow you to drop the head forward in a push-up or in a plank. We don't allow you to bring the hips forward or lean backward in a pull-up. You got to put yourself straight up. If you can't do that, you can't do pull-ups. And instead, you might do a machine pull-down right? Bar pull down, whereby you put a quarter to a half the person's body weight. How many times can you do that to get a basic recognition of someone's basic strength endurance at this moment in time? Push-ups are very, for some people, they are maximal strength for some people. That's why we say muscular strength and muscular endurance. Some people, a push-up, being able to do 1 or 2, no more than 5 or 10, it's going to be near maximal strength type exercise. But someone can do 15, 20, 25, 30. Clearly, that's more to muscular endurance for them, right? And of course, pull-ups for most people are going to be maximal strength if they're able to do them at all. And that's why we'll typically do the machine pull-down if they can't do the pull-up. They'll pull it down, not going down to your chest. We got to lose this idea that it has to go to a certain place on someone's body, or that something has to lock out or anything like that. We never want to lock out a joint. Whenever you nothing wrong with straightening a joint out, straightening your elbow when pressing. There's nothing wrong with that at all. We don't have it slightly bent. No, we have it straight. There's a difference between straight and locked. We don't want to lock a joint under load ever. The compressive forces are so significant. There's maximal congruency of 2 bones, creating a lot of stress in that joint, or near maximal congruency or stress on that particular joint when you have those 2 bones pressing compressive forces against one another when they're locked out. It's not worth the risk for any reason under load. That said, we do want the person to have their arms straighten out the bottom of the pull-up. Okay. Likewise, or the beginning of the pull-up, we should say, and the push-up should have the arms straighten out as they push themselves up. Arms should fully straighten. What's fully? Well, whatever they can do without pain or discomfort. Okay. That said, from a pull-up standpoint, for upper body pull strength, versus a push-up standpoint for upper body push strength, and lastly we'll do lower body strength, which is the leg press. Why the leg press? Well, there's nothing wrong with doing squats and deadlifts, but in fact that would be ideal. Person being more significantly capable of handling stress while squatting or deadlifting would be much preferred over leg press, but this is day 1. We don't really know exactly how much coordination this person has, how much load they can handle. We want to see something that's much more coordinated, much more controlled, doesn't have as much control challenge for the person that we don't understand or fully know enough about yet. So we'll do leg press with them to get a better understanding of what's going on with lower body strength. How many times can you press up and down on the leg press your body weight on the leg press? So if you weigh 200 pounds, we try to get 200 pounds on the leg press. You're going to have to do your best to assess in some machines how much the machine weighs itself, not just the load itself. You're going to have to do some tinkering because every machine is a little bit different. Every leg press is a little bit different. But you want to keep it consistent with every person, as close to their body weight as possible, to have a general idea what the person's capable of doing. Noting that a lot of men are going to typically perform better at the push-ups and the pull-ups than women are. Planks are fairly even in a lot of ways, but push-ups and pull-ups are almost always swayed much more toward men, typically more due to the fact of not just testosterone, whereby that's going to increase the probability of muscle mass increase, more probability of producing more force, that's certainly true, but also the rib cage and the shoulder girdle are wider in most men than in women, so consequently it also allows them to lift more load upper body wise with less stress or challenge to be able to produce enough force to be able to move more significant loads or to do more challenging exercises. Whereas leg press often favors more women because of their wider hip girdle and their pelvis. Consequently, they actually have greater capability of oftentimes relatively their body weight be able to handle more load versus a man. So that's not always true, but those things definitely play a role. Structure plays a big role with men and women or anyone. Longer-legged people or longer-armed people are going to have a hard time performing as well in all these strength exercises, or bigger people will have a bigger challenge as well than smaller people because they're moving shorter levers versus longer levers. So a lot of variations that go into this. Ultimately, at the end of the day, with doing these assessments, we want them to have numbers they can go home with, to look at themselves a little more clearly about having an idea. And we're getting almost all the assessments done here. We have a couple more that we'll still talk about. But how much can we get them to understand about themselves, let alone what information can we glean from this assessment to get the most information possible to know best how to handle helping this person improve from where they are, to get better, to lose weight, to get stronger, whatever it is they're looking to do, and to do it as well as possible, safely, efficiently, and effectively. We have one more video segment for assessments in the first client training session. We will see you for the next video coming up shortly.